Snakes may occasionally be presented for examination. A word of caution: avoid working with venomous snakes unless you and your local hospital are prepared to deal with the ramifications of a bite. The most common snakes we see are boas and pythons that constrict their prey prior to eating. There are many species of these, and some, such as reticulated pythons, have a nasty reputation for aggressiveness, while others, such as ball pythons, are very gentle. It is helpful to familiarize yourself with different species characteristics, but remember to consider each patient's temperament individually and approach all with caution. A snake's primary defense mechanism is biting, and even though it may not be venomous, the sharp teeth are painful and prone to producing infections. Irritated or hungry snakes are most likely to bite, as are snakes that may be fearful because their vision is impaired by retained spectacles, the grayish-colored film covering the snake's eyes. The way a snake is brought into the hospital affects the capture technique. Whenever possible, ask the client to bring the snake in a cloth bag or pillowcase that is tied securely. A snake is unlikely to strike through a cloth bag or pillowcase. The snake is removed from the bag after his head and neck are secured. Frequently, you can, by feeling the bag, locate the head and grab the snake's neck. Then peel the bag away from the snake. Alternately, lay the bag down with an opening visible. The snake will likely move toward the opening, at which point you can take hold of its neck. Many pet snakes are handled quite a bit and may come in over the owner's neck or in hand. Often these snakes can simply be passed over hand to hand. Remember to secure the head during potentially uncomfortable stimuli. Some snakes will be brought in a cardboard or plastic box. The docile ones can be grabbed by approaching from behind the head. More aggressive snakes can be blinded with a towel thrown over the head, then grabbed while it can't see you to strike. Once the head is restrained by gripping it just behind the jaws, it is ready for examination. With large snakes, more than 4 to 5 feet, more than one restrainer may be necessary to control the body, while another assistant takes the head. After the exam or procedure is finished, the snake is returned to its cage. This is the time the animal is most likely to be perturbed and want to bite. Evidence that the snake is in an aggressive state are opening the mouth, lunging at people, thrashing, becoming increasingly violent, and eliminating fecal or urinary waste during handling. For safety, snakes exhibiting these signs should always be returned to a bag or pillowcase, even if you have to lend one from your clinic. Place the body of the snake in the bag, keeping hold of the head. When all but the head and neck are inside the bag, lower the head inside the bag, maintaining your grip on its neck. With larger snakes, grab the neck and head through the bag prior to releasing your grip. Small snakes can be dropped into the bag at this point. Fold the bag over and secure it tightly with tape or twine. Docile snakes can simply be placed in their bag, box, or into the owner's hands. Lizards come in all sizes, shapes, and forms. We will discuss the green iguana, as that is the most common pet species, and the handling techniques can easily be applied to other species. A large, aggressive iguana can be a formidable adversary to the veterinary technician. Their primary defense is lashing their tail at potential predators, although closer encounters may result in a hand bite with razor-sharp teeth. You can predict aggressiveness in the iguana if it is standing out on extended legs like a sawhorse with its dewlap fully extended. Even friendly iguanas must be handled carefully as their nails can be very sharp. They will scratch with both front and rear limbs, and their tree-loving nature causes them to want to climb, even if it's up your arm and over your face to get to the top. The nervous or aggressive iguana will stand very still in a defensive posture. It is trying to make itself appear larger to potential predators while hoping its stillness and color will provide adequate camouflage so that a fight won't ensue. Once he's convinced by your hand's approach that his guises aren't working, he will thrash and flail wildly with tail and claws. A hand too close to the mouth can also get bitten. The key to subduing this animal is to gain control very quickly before his defenses become effective. Approach from behind the animal's neck. Use your strong hand to quickly grasp the back of his neck and shoulder regions. With the other hand, you should then grab his pelvis. With a good grip, lift the iguana from the box, cage, or tabletop. At this point, it is common for them to thrash about and try to bite, although some animals will be subdued immediately. Regardless of its apparent behavior after capture, it is wise to restrain the tail. This is easily done by catching the tail between your arm and chest, as shown. For tabletop procedures, you may ask another assistant or the owner to hold the tail. Smaller iguanas with tails that are not as prone to creating injury may simply be held vertically with the tail unrestrained. Continue to hold the iguana for examination by the neck and shoulders and the pelvis. Your restraining hands should remain over the back of the iguana to avoid being scratched. Some iguanas are easier to examine while being held in a standing position on the exam table, but most are more subdued when held out away from the table. A towel may be useful for capturing some iguanas, but remember there's still the fight or flight response that will be triggered once a towel hits. The towel, while providing some protection against the flailing, can cause you to lose control of the shoulders and pelvis, as the animal will likely twist and roll as soon as they feel the towel. Better protection and utility can be achieved by using leather gloves if you can retain good hand control. As with most species kept as pets, many iguanas are quite tame and don't require the level of subduing and restraint that we just described. Learn to assess their personalities. Always provide at least gentle restraint to ensure the safety of the patient, handler, owner, and doctor. After the exam, the iguana is placed back in its box or carrier. He may thrash, but if your hands are above him, you will not get hurt. If a carrier is provided, place the animal in head first. Keep your grip on the shoulders while you or an assistant then load the tail into the carrier. Be very careful if bending the tail to get it into the carrier not to overflex the tail, as you could break it. Once fully in the box, release your shoulder grip. Quickly remove your hand and close the door. Nail trims are easy to perform on iguanas. 2 people are required, one to restrain the iguana while the other trims the nails. We use the Dremel tool on iguanas for the same reason as we did with birds. An iguana's nail, when sharp, typically has a distinct notch on the bottom of the nail where the tip curves over. This point can be filed back to the notch as shown. Keep Quick Stop handy in case you go too deep, causing the nail to bleed. Next, we will discuss turtles. With the exception of alligator snapping turtles, which can strike as quickly as a snake, or soft-shelled turtles that have extraordinarily long necks that can reach the unsuspecting handler, turtles are fairly safe to handle. Gloves are recommended as many turtles carry salmonella. Always capture a turtle from behind the head, grabbing the shell. He can then be picked up and presented for examination. The veterinary assistant is most frequently called to help with a turtle or tortoise when a detailed head exam requires 2 hands or medications need to be administered. There are a few tricks to getting hold of the head. If the neck is extended, come from over the back and grip the turtle at the base of the neck with thumb and forefinger. Hold tight as it will attempt to retract its head. The stubborn turtle will keep his head tucked inside the shell. Sometimes prodding his rear legs will stimulate it to extend his neck. Holding the turtle at various angles, but particularly with the head pointed down, may cause it to poke its head out. You may even try to submerge the turtle in water. It will be able to hold his breath, but eventually sticks his neck out. Be patient and attentive when trying to get a turtle's head captured. Once the head extends, grab it quickly, as they are quick to retract into the protectiveness of their shell.